And joining me now for our live coronavirus special is Dr. Julie Pannullo, an internal medicine specialist with Advantage Care Physicians. So thanks for being here with us tonight.
Thank you for having me, Gianna.
So this week, we kind of confirmed that we are on the other side of the peak in terms of hospitalizations. So what's been going on where you practice or with doctors that you know?
So I'm a practicing internal medicine physician with Advantage Care Physicians. And, we have 38 locations in all the neighborhoods of New York and Long Island. And what we're seeing is, there's a lot of quarantine fatigue going on now. And people are ready to move out. They want to start coming into the offices. They're asking to come in for their chronic care conditions. So I think, people now that we are turning a corner, they feel like they need to get back to a little bit of their routine.
And do you feel like it's too soon for that, or do you feel like we can handle it at this point to start opening things back up?
That's a difficult question. It's really hard to say. I think in New York, there are certain regions that have had a lot of active disease, other regions that has not been a lot of active disease. And I think it's time that we at least consider opening up certain regions. I think today, Governor Cuomo of this past week has put together a plan just at least looking at the disease severity in different regions and start to consider which regions in a phased way can start opening.
Yeah, it does seem like they're going to be taking that kind of regional approach. Now, in terms of being a healthcare provider, do you feel as though there has been a shift in this decline from the peak?
I'm definitely seeing slightly fewer patients calling in, with severe shortness of breath. But we still, there's still a good portion of my day will be going through patients that think that they have COVID. And now with this new testing availability, we're even getting more phone calls just trying to understand if they can get tested, where they can get tested. I think there's a lot of anxiety out there as well. So we're certainly getting quite a few phone calls regarding COVID. The good thing is at this point, we do have telehealth availability. We have behavioral health services. So we do have something to provide to our patients that are calling in.
And do you feel like testing has been helping the situation? And there is more testing available, and now we're talking about antibody testing. Has that been helpful in your patients addressing their concerns?
So, it's a very difficult conversation, especially now. There are so many tests out there. The sensitivities, the specificities, the accuracy of these tests are all varying. There's a lot of confusion going around, both for physicians and providers right now. So, and many of these tests are FDA approved, yet at the same time, we are hearing that there's some level of false positives and false negatives. So even if a patient is having a test done at some of the walk-in or drive-through locations, they still really need to contact their physician to just better understand what the test results mean. So, at present time, we have two types of basic testing in New York, and some the diagnostic testing and the serology testing that we've all heard about this week. The diagnostic testing are those nasal swab tests, and they check for infection, whereas the serology blood test that's come out recently is testing for the antibody, and it's checking for immunity if you've had past recent infection possibly. But again, there's a lot of variability in the different tests that are performed. So you really need to be careful about what the test result actually means for you.
Yeah, so definitely talk to your doctor. Now, this week we've been hearing more about remdesivir, and today the FDA granted that emergency authorization. So what exactly is this drug, and how does it work with this virus?
So remdesivir, it's an antiviral drug, and it was initially tried for Ebola, and however, it did not work. So it works on an enzyme, so it prevents the virus from actually infecting. The study was a small study, I think about 1,000 people, and it showed a 30% reduction in symptoms. So what that translated to was instead of 15 days of symptoms in a severely ill patient in the hospital, it reduced it to about 11 days of symptoms. So that was about a 30% reduction in symptoms. However, this study did not show a reduction in mortality. So that's important to note. And it's not the drug, it's not the cure. It's definitely not the cure, but it's definitely a step in the right direction. So more to come on this as larger studies come away.
Yeah, of course. And I know at first some were excited about hydroxychloroquine, and then it kind of seemed to not be as successful as they thought. So is there a difference in what's going on now with remdesivir versus hydroxychloroquine weeks ago?
Yeah, they're all different mechanisms of action. They all are attacking the virus in different ways in the body. Some of them are preventing the virus from getting into, from actually attacking the body and its cells. Others are reducing the inflammatory reaction that someone has to the virus once it's infected. So there are many different mechanisms for these drugs that are coming out.
And have you seen any other medications or healing techniques that have been working? I know a couple weeks ago I was talking with a doctor that was talking about how they're putting some patients on their stomachs to help with their lungs. So has there been any thing that you've been seeing?
Yeah, so no, these are all like maneuvers, in the hospital. These are things that they do to just like move the fluid around in the lungs, where they have them lay on their belly to reduce. Most of your lungs are in the back. So if you lay on your belly, it kind of pulls the fluid away so you can get more aeration in your lungs. So, it's just, I think a lot of drugs, therapeutics starting to come out in the future.
Yeah, I'm sure as time goes on, you learn more about it. Now we're talking about the state possibly taking steps to reopen. So when the states do reopen or people start traveling again eventually, what precautions do you think people should take until there is a clear-cut treatment or vaccine?
I think we should continue doing what we're doing. I think even when we come out of our homes and we're starting to normalize slightly, we need to recognize that there's still a lot of people that are positive. They have infections. We need to continue making sure that we're washing our hands, we're wearing our face masks when we're in public. We continue, of course, social distancing as much as possible. We're avoiding crowded spaces. So all of those measures that we're currently taking place and these measures that have proven to flatten the curve, we need to make sure that we're continuing to do them even when we start to open up in phases.
Yeah, and I know the principal deputy director for the CDC today was saying how we fight it in the summer will be critical as to how the virus will evolve in the autumn. So what would be your advice on handling this virus in the summer now?
So I think as a physician, I really would like to urge my patients that have chronic medical conditions, these comorbid conditions, to make sure that they are addressing them, especially in the summertime this year, making sure that you are healthy, really in case there's a second wave later in the fall. It's really important that they are healthy going into the fall season, winter season this year. Make sure that all of their vaccinations are up to date, that they're seeing their primary care physicians, making sure that all of their medications are appropriate. Any testing that they need to do is done in the summer if possible, because there is a potential that in the fall, again, we're going to be in a situation where we're going to be in our homes for a long period of time.
Yeah, we have seen, of course, elective procedures and things like that not being able to go forward. So if they can, to get them taken care of in the summer, you're saying to go forward with that.
Yeah, especially chronic diseases, because these chronic diseases really add another layer to getting a COVID infection. So really make sure that you are on par, getting your diabetes, getting your cholesterol, all of these, medical conditions under control.
And do you think like people getting just like your typical physical, if they haven't gotten it this year when things open, is that something that could be kind of important in checking where you're at?
Yeah, it could be, but if you're healthy, it's going to be a difficult transition into opening, even for physicians' offices. We're not going to be able to necessarily open at full capacity. We may be having patients because we need to social distance indoors. We may need to make sure that there's enough space available in the offices, though, so people can come in. So we may need to stagger patients. Because of that, we're going to have to prioritize patients that need to get in first, such as our chronic ill patients, sick patients that are acutely sick. And sometimes the routine visits can wait a little bit and we can address their medical conditions. The disease management is probably much more important during the summer.
There you have it. All right, so we are going to take a short break here. We'll be back with the doctor answering some more questions. So if you do have any questions, you can post them on our social media accounts and we'll be sure to get them addressed. Stay with us. Welcome back to our live coronavirus special. I'm Gianna Gelosi. Joining us tonight is Dr. Julie Patel-Pannullo, an internal medicine specialist with Advantage Care Physicians. So once again, thank you for being here with us tonight, answering all of our questions.
Thank you for having me.
So during this pandemic, we've seen kind of the way medicine's done, like shift a little bit with telehealth appointments. I've had a bunch of telehealth appointments that I've never, had previous to this pandemic. So do you think that things like this will continue as things do open up eventually?
Oh, absolutely. Absolutely. I think telehealth has been a game changer in healthcare. At Advantage Care Physicians, in just 1 month, we've done over 20,000 telehealth visits for our patients. We're able to see patients for minor conditions. We're able to see patients that have COVID and they're COVID positive and they need medical care and it is not safe for them to come into our offices and infect healthy patients and infect our staff members. So this is definitely a game changer in medicine. And I'm finding that many patients are actually enjoying these services and I think they're going to stay for a while. So this is a good thing.
I can say for myself as a patient, it has been pretty interesting. Like if I'm not getting any tests done, it's good just to kind of have that meeting virtually with the doctor and not wait in the waiting room and all of that. How has it been on the doctor side of things?
I think on the doctor's side, it's been excellent, excellent. Most of our physicians have enjoyed doing it. It's definitely something different. And you learn to examine a patient, on video and trying to figure out a diagnosis. And many conditions can actually be diagnosed with a really good history. So I think it's been eye-opening how effective telehealth has been for us. We've been applying it both for regular medical chronic care diseases as well as especially for nutritional services, as well as for behavioral health services, which is just huge right now.
Yeah, mental health is huge. And I know today Governor Cuomo announced that mental health services will be free for frontline workers. So do you think that'll have an impact on your colleagues? Is that something that people have been talking about? I know I have friends in the medical field that are saying it, has been a lot to kind of process on their own.
Yeah, I'm hearing that a lot, both from patients and from physicians. This is a long-term thing. So it's not just quick done and go. The virus is going to be here for a while. There's a lot of anxiety in terms of people not being ready or being afraid to go back to work as we open up. There's a lot of anxiety and depression just regarding the economic situation that they may be in. So having access to behavioral health is extremely important, especially right now. Offices such as ours offer behavioral health services in addition to the resources that are available to everybody through the city and the state.
So what would you say to these people that might, as the state opens up, they have to go back to work and they might be anxious about it, or even just, I see videos that we have from last year of people at the beach in a crowded kind of beach, and I'm even like, oh my goodness, how am I going to feel when that's the reality again? What do you say to those people?
Yeah, it's difficult. It's difficult for everyone. It's just that it's really important that everyone try to continue doing what they're doing now. Social distancing. There are people that are just not going to comply. But the more of us that continue to follow the directions that we're given as we open up in phases, I think, the better, obviously. And then the more that people are talking to each other, learning to cope, it reduces anxiety. So I think once we step into that phase, it'll be a little bit easier, but not knowing right now makes it a lot more anxiety provoking.
Yeah, definitely. Now, as we continue into the summer and then eventually the fall, of course, then we have the threat of, the second wave of corona, maybe, and then maybe, you don't know what the flu season is going to entail. So is there any precautions that doctors' offices are thinking about or taking at this stage?
Yeah, absolutely. So again, as I mentioned, we are all trying to get our chronic disease patients into our offices so we can manage them early on. We're trying to be really proactive about this, trying to reach out to them now to make sure that they have an appointment scheduled with us. In addition, we're trying to reach out to all of our patients that have not gotten vaccinated for all of those other viral diseases that are out there, trying to make sure that they are protected against other things as well. As the flu season approaches, everybody will be hearing more and more about getting vaccinated for the flu. This year of all years, I urge everyone to make sure that they get vaccinated for the flu virus because the risk is much too high to get both the flu as well as COVID-19 this fall.
Yeah, I'm definitely have been one of those slackers in the past that slack on the flu shot, but this year I will be getting it. So do you have is there a good time to get the flu vaccine, or is there a time that's too early, too late? When do you recommend it?
Yeah, usually I recommend it by September, October, because the vaccine takes about 4 to 6 weeks to activate. And then, the flu season comes in. So you want to make sure that you take it before the season starts. But this year, it's going to be tough. I'm hoping that the vaccine comes out a little bit earlier in case there is a surge early fall. So it's hard to say. When it comes out, it's a good time to just get it.
Go in and get it. There you have it. So do you foresee, as we open things up now, elective procedures starting to open back up anytime soon? Do you think it's going to be on a case-by-case basis? What do you predict?
Yeah, absolutely. I think elective, it's going to be soon, this week, I believe they're starting to open up for elective procedures again regionally. Also, I think when it opens up for elective procedures, the hospitals are going to also have to deal with this. The surgeries, again, with social distancing within the hospitals, the capacity might be a little bit lower than what it had been without the pandemic. So they probably are going to prioritize the elective surgeries that are more urgent than those that are not.
Yeah, of course, because elective can be anything from, heart surgery, cancer surgery to anything else.
Right.
So what would you advise patients that might have something that they might have to get taken care of? Reach out to the doctor, or how should they keep tabs?
Yeah, I would reach out to the surgeon, see if their hospital is starting to do elective procedures, and see what the new protocol is in terms of having them cleared to do surgery. So definitely reach out to your surgeon, reach out to your primary care physician.
Perfect. So it seems like now is the time to kind of get all your ducks in a row in terms of your health for the summer and going forward with the fall.
Absolutely.
Perfect. All right. So we're going to take a short break once again, and we'll be back with the doctor in just a few short moments. So be sure to stay with us. I'm speaking with Dr. Julie Pannullo, an internal medicine specialist with Advantage Care Physicians. So we've kind of been talking about the steps we should take moving into the summer as the country reopens, and a lot of people worried about coronavirus now. But have you seen any kind of lasting damage that the coronavirus can have on a person's body, on their lungs?
Absolutely, absolutely. So the coronavirus causes a inflammatory reaction within the body, and most cases are mild. However, those patients that have been hospitalized with more moderate to severe diseases certainly are coming in, with bilateral pneumonias. Those that are, some of them are on ventilators, of course, everyone knows, and the residual effects of these can be scarring in the lungs. The virus also can affect the kidneys and the liver as well as the brain. So there's certainly repercussions post-recovery. There can be some heart damage that's residual, some kidney damage that's residual, lung function that's residual. So it's not necessarily that you go back to 100% normalcy, depending on the amount of damage that has occurred during infection.
Of course. So do you have any quick advice for those maybe dealing with that?
Nothing. It's basically take care of yourself. Make sure you're seeing your physicians when you get out of the hospital. Make sure that you're taking all of your medications. You're trying to lead a healthy lifestyle with exercise, eating well, taking your medications. So, that's all. And that and time will tell if the organs improve.
There you
And
go.
if you're
So that seems to be our theme for as the country opens up. Take care of yourself, take care of your health. Dr. Pannullo, thank you for joining us. It was nice having you. So for those watching, stay with us. We will have more on